Hello everyone, welcome to episode 3 of Ethical Dilemmas, where we explore the tough questions that arise at the intersection of medicine, ethics, and society. Today, we're diving into a question that challenges the very core of medical practice. Should doctors respect a patient's decision to refuse treatment based on religious beliefs? Joining us are two distinguished guests. Dr. Marcus Fields, a renowned bioethicist known for his deep insights into the moral complexities of medicine, and Dr. Anjali Joseph, a practicing physician who navigates these ethical dilemmas every day in her clinical work.
Thank you for having me. It's a pleasure to be here discussing such a critical issue.
I'm glad to be here as well. This is a topic that we face quite often in practice, and it's one that requires careful thought and consideration.
Let's get right into it. Dr. Joseph, as a practicing physician, you're often on the front lines when a patient refuses treatment due to their religious beliefs. What goes through your mind in those moments?
When a patient refuses treatment based on their religious beliefs, it's a complex situation. As a physician, my primary goal is to do no harm and to preserve life. But I also have to respect the autonomy of my patients. For example, I once had a patient, a Jehovah's Witness, who refused a life-saving blood transfusion. As a doctor, it's incredibly difficult to stand by and watch when you know there's a solution that could save them. But their beliefs were unwavering, and I had to respect that.
Dr. Fields, from an ethical standpoint, how do you view this conflict between a doctor's duty to preserve life and respecting a patient's religious autonomy?
This is where the principles of bioethics come into play. Autonomy is a fundamental principle. It acknowledges a patient's right to make decisions about their own body. However, there's also the principle of beneficence, which obligates the physician to act in the patient's best interest. The challenge lies in balancing these sometimes conflicting principles. Religious beliefs often touch on deeply personal convictions, and in a pluralistic society, we must respect these differences, even when it means allowing a patient to refuse potentially life-saving treatment.
But what happens when a patient's refusal of treatment not only endangers their life, but also has broader implications, like in the case of contagious diseases? Should religious beliefs still hold the same weight?
That's a great point. In cases where public health is at risk, such as with contagious diseases, the situation becomes even more complicated. The patient's decision doesn't just affect them, it affects others around them. This is where the ethical principle of justice comes in, which considers the broader impact on society. In such cases, we may have to weigh the patient's individual rights against the potential harm to others.
Exactly. But even in these scenarios, we must tread carefully. Forcing treatment can lead to mistrust in the medical system, especially among religious communities. It's important to engage in open, honest conversations with patients, exploring alternatives that respect their beliefs while addressing public health concerns.
Let's consider another religious context, this time within the framework of Islamic beliefs. Suppose a Muslim patient refuses to undergo an organ transplant because they believe it interferes with the body's sanctity after death. How would you approach this situation?
Islamic beliefs about the sanctity of the body can vary, but some Muslims may interpret religious teachings as forbidding organ transplantation, especially if it involves removing organs post-mortem. As a physician, I would approach this situation with the same level of respect and cultural sensitivity as I would with any other religious belief. I'd start by discussing the patient's specific concerns, perhaps involving a religious leader or scholar if the patient is comfortable with that, to explore whether there are interpretations within their faith that might allow for the procedure.
This scenario highlights the importance of understanding the diversity within religious practices. In Islam, opinions on organ transplantation can differ widely. While some scholars permit it under the principle of saving a life, others may hold a stricter interpretation that prohibits it. Ethically, the key is to respect the patient's wishes once they are fully informed of their options. However, if the refusal places the patient's life at immediate risk, the ethical dilemma deepens. Should the physician push harder for the treatment, or should they step back and honor the patient's decision?
This raises a complex ethical question. Is it ever appropriate to challenge a patient's religious beliefs if it could save their life?
This is a delicate area. Ethically, it's important to avoid coercion, but it's equally important to ensure that patients are fully informed. In some cases, a patient may refuse treatment based on a misunderstanding or lack of knowledge about their religion's stance on the matter. Engaging in a respectful dialogue, possibly with the involvement of a religious advisor, can sometimes clarify these issues without undermining the patient's autonomy.
Absolutely. I've had experiences where patients, after discussing their options with a religious leader, decided to proceed with treatment. The key is that the decision must come from the patient, not from pressure by the medical team. It's about finding that balance between advocating for the best medical care and respecting deeply held beliefs.
So, in cases where religious beliefs vary widely, such as within Islam or other religion, how do you ensure that the patient's decision is informed and autonomous?
The diversity within religions means that physicians must be well-informed and sensitive to different interpretations. Providing patients with access to religious counseling, being open to discussion, and ensuring that they have all the necessary information are critical steps. It's not just about knowing the medical facts, it's about understanding the cultural and religious context in which those facts are received.
And in some cases, involving a multidisciplinary team that includes ethicists, religious leaders, and medical professionals can be beneficial. This team approach can help navigate the complexities of religious beliefs and ensure that the patient's decision is respected and informed.
Let's consider yet another religious context. What if a patient is part of a religious community where they believe in healing through prayer rather than medical intervention? If a child from this community is sick and the parents refuse treatment on religious grounds, how should a physician respond?
This is where the ethical waters become murkier. When a child's well-being is at stake, the physician has a duty to protect that child's health. While parents have the right to raise their children according to their beliefs, there are limits. The state often steps in when a child's life is in imminent danger. In such cases, as a physician, I might work with social services to ensure the child receives the necessary care, despite the parents' wishes.
Philosophically, this raises questions about the nature of parental rights versus the rights of the child. Is it ethical for parents to impose their beliefs on a child if it puts the child's life at risk? The state often views the child's right to life and health as paramount, which can override parental autonomy. But this can lead to significant tension between religious communities and the state, potentially leading to legal battles and broader societal implications.
It seems there's a recurring theme here, the clash between individual rights and societal obligations. How do we reconcile these when religious beliefs are involved?
Reconciliation is challenging because it requires respecting the individual's autonomy while considering the collective good. Philosophers like John Stuart Mill have argued for the harm principle, which suggests that individual freedom can only be restricted to prevent harm to others. However, in the context of religious beliefs, harm is subjective. What one sees as harm, another may see as salvation. Thus, the reconciliation process often requires a case-by-case approach, engaging in dialogue with all parties involved.
In practice, that dialogue is crucial. I've found that taking the time to understand a patient's religious perspective and explaining the medical options in a respectful, non-coercive way can sometimes lead to a compromise. For example, in the case of the Jehovah's Witness patient, we eventually found a bloodless surgery option that aligned with their beliefs. It wasn't the ideal solution from a medical standpoint, but it was a respectful one.
Let's throw a curveball into the discussion. What if the patient's refusal of treatment isn't based on traditional religious beliefs, but on a more personal, spiritual philosophy? For example, someone who believes in a natural death and refuses all medical intervention.
This scenario blurs the lines even further. If we define religion broadly, including personal spiritual philosophies, then we must respect these beliefs just as we would traditional religious doctrines. The ethical challenge remains the same, balancing respect for the patient's autonomy with the physician's duty to provide care. The difference here is that the belief system might not be as well defined, making it harder for the physician to navigate.
And in these cases, the physician's role is to ensure the patient fully understands the consequences of their decision. If the patient is competent and fully informed, then, as difficult as it may be, we have to respect their choice. It's about ensuring that the patient's decision is truly informed and not a result of misinformation or fear.
As we begin to wrap up, what's the current consensus in the ethical community on this issue? Should doctors always respect a patient's decision to refuse treatment based on religious beliefs?
The current consensus leans toward respecting patient autonomy, even when it conflicts with the physician's medical judgment. The ethical community generally agrees that forcing treatment on a competent adult against their religious beliefs is not only unethical but also legally questionable. However, when it comes to minors or public health risks, the situation is more complex, and sometimes intervention is warranted.
I agree. The key is communication, understanding, and respect. We must ensure that patients are making informed decisions, and we must respect those decisions even when they challenge our own beliefs and medical training. It's not easy, but it's necessary in a diverse society.
These discussions reveal just how intricate the interplay between medicine, religion, and ethics can be. We've touched on different beliefs, including Islamic and personal spiritual beliefs, all of which present unique challenges in the medical context.
Indeed, each religious or spiritual belief system brings its own set of ethical considerations, which is why the conversation must remain open, respectful, and patient-centered. The diversity of beliefs we encounter underscores the need for a nuanced approach in medical practice.
And integrating a multidisciplinary approach, where ethicists, religious leaders, and medical professionals collaborate, can be incredibly beneficial. It helps navigate the complexities of religious beliefs and ensures that patient decisions are both respected and informed.
Thank you both for your invaluable insights. This debate is far from settled, and it's clear that these issues will continue to challenge us as medical professionals and as a society. Before we go, we invite you to continue this debate in the comments below. Share your experiences, thoughts, and opinions. We want to hear from you. Subscribe and follow for more thought-provoking discussions. And remember, in the world of ethics, there are no easy answers, only deeper questions.